So let me start in terms of what is it that I'm going to try and achieve in the next 5-7 minutes very quickly before we're going to have a set of startups then present their solution. The objective that I have in mind is more in terms of set the context from a India healthcare industry overview in terms of what are some of the challenges that India healthcare faces, and we have been hearing a lot of them on the last yesterday and today. I think it's about time we talk about solutions, right? So we then are going to lead up and say that what are the different themes that some of these innovative solutions could probably fall under, and which would set the context in terms of the further sessions to come. So a few things in terms of numbers, right? So if you look at the challenges that we are faced with, probably one of the biggest challenges that we are faced with is in terms of a clinical support gap, right? As per some estimate, we talk about, in India we are short of about 1 million beds. We talk about we're short of a couple of million doctors, probably 3 million nurses. And that puts a lot of pressure both on the public health as well as on the private health space in terms of trying to do more with less, and hence productivity and looking at things like throughput becomes a big priority for hospitals today. Second is in terms of what's going good. So what's going good is that the healthcare system is doing well, and that is resulting in the life expectancy at the time of birth, which is expected to go up. What that also means is that it's going to make sure that we are going to have a big increase in terms of an aging population as we go along in the few years to come, which means that the challenge that we are going to contend with is the healthcare system equipped enough to cater to audiences with services such as geriatric care? Is that an audience that we are prepared in order to go ahead and support? Probably that's an opportunity that exists. We also have 75% of Indian population not having any form of insurance. So there is a big under-penetration from an insurance standpoint. I don't know if that's a good thing or a bad thing, but then what it also means that any form of healthcare spending or a big form of healthcare spending is out-of-pocket expense. What it also means that we can talk about the percentage of spend on healthcare being a very small percentage as a part of overall GDP, and there is a big big need for improved spending from that perspective. But also what it leads to is that that's not a sustainable approach. It's not going to be sustainable for private healthcare or public healthcare to continue to increase spend in terms of curative things for them to go ahead and do. What it means is that the only way you can solve that problem is going to be to look at areas such as preventive healthcare. And you would have heard in the last 2 days, that's something that's been spoken about. The other point that I would want to make is that an increasing trend that's being seen, and this is not something that's specific to India alone. This is something that you get to hear it mirrors what is happening globally as well, is in terms of the growing number of non-communicable diseases and the chronic diseases which are there. Today, the healthcare system is more aligned to take care of curative forms of care, right? Where you as a patient come to a hospital, there is a disease condition, the hospital tries to cure you, and then you're sent back. But in contending with chronic diseases, it's completely different. The patient, you're not talking about curative, you're probably talking about healthcare management, right? And there is a possibility that the patient is going to repeatedly come back to the hospital, which means that from a healthcare perspective, you would probably need tools, you would probably need to transform yourself to be able to take care of some of those realities that exist. Now, given all of that, where's the opportunity? The opportunity is in terms of some of the solutions that you're going to probably see after this. There are 3 themes that clearly emerge in terms of how we should be thinking through in terms of what the rethink is going to be. One is in terms of moving the patient to the center of healthcare delivery. And patient engagement becomes a very key aspect of this rethink. And in terms of how probably some of the technology solutions that can go and help in making that happen. Second is in terms of increasing productivity. We spoke of this big pressure to do more with less, to get better throughput in terms of the existing infrastructure, the number of doctors, the number of nurses that we have got. And that is the theme of increasing productivity. Third is in terms of clinical excellence. This is the core reason for the existence of the healthcare system, and there are a variety of things that can go into in making that that possible. A few more things in terms of what are the trends that we are seeing in each of these. Let's look at patient engagement. Healthcare is a segment where demand far outstrips supply. You have a lot more people needing care than you have infrastructure. Typically in industries such as this, the customer is never usually king. It is something that is an industry that is driven by providers. But then you see a transformation that's happening in this context, where there is a transformation of being a patient to being a customer, where the healthcare system would want to go ahead and treat the patient as a customer and engage the patient as a customer. Second is the trend that is happening is in terms of the number of people that are embracing digital. Often you'd hear from healthcare is that doctors are not so used to technology, they push back on technology. But the fact is that the patient has moved on. We are talking about, by some estimate, by 2020, you're going to have about 800 million smartphones that are there, smartphone users that are going to be in India. And we heard of, for services such as, Facebook or WhatsApp or Skype, India is probably among the top 5 user base for any of these services. So in reality, what has happened is that the patient has moved on. The patient is expecting a set of digital experiences, consistent, innovative digital experiences that the health provider can go ahead and give. Third is the concept of preventive healthcare, which we spoke of. The concept is in terms of moving from healthcare to wellness. And where is this disruption coming from? Very interestingly, this disruption is not coming from outside the industry. It is healthcare organizations are looking to self-disrupt. Healthcare organizations are looking to say, how is it that I can keep patient from entering the healthcare system in the first place? And out of whatever eventuality, if he does need to enter the healthcare system, then the hospitals are always there to take care. And then they need to engage in the entire spectrum of the care continuum. So from a patient engagement standpoint, possibly these are some of the areas where the challenges can translate themselves into opportunities for innovative solutions. Second is the theme of clinical excellence. This is the core reason for existence of a healthcare organization. And we see that there are 3 distinct themes that are coming about here in terms of the challenges and what they translate into as opportunities. One is the entire digital effort, however minimal that it may be at this point of time, it would only succeed if the data that is coming in from there is put to good use, if it translates into information. So one big area where there is an opportunity is in terms of how is it you can make sense of the data that exists in the healthcare system today. And it is not a big challenge. You have innovative solutions, because you often hear saying that we have very low EMR adoption that is there and we don't have data. Where is the data, right? But then you have fantastic innovative solutions from startups that are available which use minimal information sets. If you have a digitized billing system, if you have a digitized PAC system, if you have a digitized lab information system, this is enough for a lot of analytics to really go ahead and happen. A lot of other solutions are also pivoted around the area of patient safety, around the area of continuous skilling and medical education, in terms of making sure that there is quality manpower that's available from an industry standpoint. The third is in terms of productivity. We spoke of the theme of how to do more with less. So there is innovation happening in terms of increasing productivity at 3 levels. Level of an individual, what is it how do you make your doctors more productive? How do you make your nurses more productive? productivity at the level of an organization, which is where you find that hospitals are looking at saying that there is it's 6 hours is the kind of time that our discharge process takes. How can I get that lower? So some of the metrics that they go ahead and track is some of the areas that hospitals are looking at. And third is in terms of infrastructure. How do I make sure that the infrastructure that I put up, because the cost of healthcare is also hugely governed by the cost of the infrastructure that is put in, and how do you make sure that the infrastructure is working more optimally? So these are some of the areas in terms of opportunity that exists along these 3 themes, and that's something that I wanted to set to you more in terms of the context for the solutions that are then going to be available, the innovation that's going to be available. Thank you.